Heart failure is a condition in which there is impaired ability of the heart to pump blood. And if you can appreciate this, then you should appreciate that the hallmark of heart failure is a reduced cardiac output. No matter what type of heart failure you have, no matter what the cause, there will be a low cardiac output in any patient that has any type of heart failure. For the next few slides, I'll go through my model of how I recommend you think about the clinical syndrome of heart failure. So I want you to imagine that we have a pump, and this pump is draining water from a tank, and that tank is being filled from water flowing in from a pipe. Now, if the pump is doing its job and it's pumping lots of water forward, the level of water in the tank will be relatively low because as soon as water comes in, it is pumped out by the pump. Now imagine if that pump started to fail and it was pumping less water forward. As a result, the water level in the tank would start to rise because water is still coming in, but the pump is removing less water from the tank. And now imagine if the pump really began to fail, so very little water was being pumped forward. Now the tank would completely fill up and even begin to overflow because so little water is being removed from the tank. Now, of course, this model is just to help you understand heart failure. Inside the body, the pump is the heart. And inside the body, there's no water, but instead there's blood. And instead of a tank, what we have are the lungs and veins. And so this is the way you can think about heart failure. As the pump of the heart begins to fail, less blood is pushed forward, therefore there's a low cardiac output. That means that more blood backs up and fills the lungs and the veins. So now that we have that basic model of heart failure in our minds, let's drill down in a little more detail on the pathophysiology. So when chambers fail to do their job, when chambers of the heart don't pump normally, more blood is left behind, as we showed in the last few slides. That blood exerts pressure on the wall of the chambers. In other words, the molecules push on the walls of the chamber and generate higher pressures in the chambers of the heart. So therefore, one of the hallmarks of heart failure is that the pressures may rise in any or all of the cardiac chambers, depending on which ones are involved. Let's talk about specific chambers. When the left ventricle fails, this leads to a rise in left ventricular pressure. Now, the left ventricular systolic pressure depends on contractility, and this can be low in some forms of heart failure. But when I say the left ventricular pressure rises, what I'm referring to is the left ventricular end diastolic pressure. This pressure is always high in left heart failure. In fact, a rise in the LVEDP is the hallmark of left heart failure. Remember from Wigger's diagram that the pressure in the left ventricle goes from a low value of about 10 or so up to a peak of about 120 or so and then back down to 10. This peak of 120 depends on the contractility of the ventricle, and in some forms of heart failure, it can become low. However, this end diastolic pressure, this low pressure inside the left ventricle, always rises in all forms of heart failure. In fact, it can go from a normal value of 10 up to as high as 30 or 40 or even 50 millimeters of mercury. The reasons that the left ventricular end diastolic pressure rise can be a little bit different depending on the type of heart failure. In systolic heart failure, less blood is pumped out of the ventricle, so more is left behind, and this raises the left ventricular end diastolic pressure. In diastolic heart failure, there is a stiff ventricle, and this leads to higher pressures. And I talk about the differences between diastolic and systolic pressure in another video. But the point I want to emphasize here is that no matter what the type of heart failure, the LVEDP will always be high, and this elevated left ventricular end diastolic pressure is the hallmark of left heart failure. And when the left ventricular end diastolic pressure rises, that will close the mitral valve at an earlier point in time before the left atrium has emptied. That will lead to a rise in the left atrial pressure. Shown at the bottom of the screen is Wigger's diagram, which I talk about in another video, but the dotted line here is the left atrial pressure, the solid line here is the left ventricular pressure, and those two pressures go together, and when the mitral valve closes right here, that's the left ventricular end diastolic pressure. So if that begins to rise, that will push up the left atrial pressure in turn. So in other words, when one chamber begins to fail and the pressure goes up, that leads to failure and rising pressures in the chamber that comes before it. So that means that once the left atrial pressure begins to rise, the pulmonary capillary pressures can begin to rise. And that can lead to two of the hallmark symptoms of heart failure, which are dyspnea and pulmonary edema. To help you understand this better, I've drawn a pulmonary capillary on the screen here. And it is the hydrostatic pressure, P sub C, in the pulmonary capillary that drives fluid out of the capillary and into the interstitial space in the lungs. So let's imagine that we have blood flowing into this capillary from the right side of the heart via the pulmonary arteries, and then we have blood exiting this capillary into the pulmonary veins and then going to the left atrium. So you need to understand that these capillaries in the lung are connected to the left atrium, so they see the pressure in the left atrium. So for example, let's imagine that the left atrial pressure were 5. This means that the hydrostatic pressure in the capillary would also be 5, and that would be the driving force pushing fluid out into the interstitium. Now let's imagine that this patient goes into heart failure, and instead of 5, the left atrial pressure becomes 20. Well, that means that now the pressure in this capillary is going to be 20. The hydrostatic pressure in this capillary is going to go way up. That's going to increase the driving force to push fluid out of the capillary and into the interstitial space in the lungs, and this is going to lead to pulmonary edema. So the key point here is that when the left atrial pressure goes up in heart failure, the hydrostatic pressure in the capillaries also goes up, and that causes pulmonary edema. And so now the process can continue to go backwards and affect more and more chambers. When the pulmonary capillary pressure rises, that can lead to a rise in the pulmonary artery pressure. And when the pulmonary artery pressure rises, that can lead to a higher pressure in the right ventricle. And when the right ventricular pressure rises, that can lead to a higher pressure in the right atrium. And remember that the right atrium is connected to the venous system. So right atrial pressure is the same as central venous pressure. So what this means is that a failing left ventricle via a domino effect of raising the pressures in all the chambers that come before the left ventricle can lead to high pressure in the venous system. This can lead to elevated jugular venous pressure in the neck veins, which is one of the hallmark signs of heart failure. We'll talk about that in a minute. It can also lead to capillary leak in the veins of the body, and that can lead to lower extremity pitting edema, another classic sign of heart failure that we'll talk more about in a minute.